Okay, hello and welcome. My name is Amy Royer. I'm the project coordinator of the Montana Rural Health Initiative. And the mission of RHI is to engage partners to share ideas and expertise and to support communities in improving health while stimulating a higher level of wellness across the state. Thank you all for joining us today for our webinar for promoting nutrition for screening seniors for nutrition health. Sorry, I was reading the one from last time. Today we have presenters Minkie, Medora, and we also have Jacqueline Stoeckel. Minkie's from the Montana State Aging Services, and Jacqueline is from the Aging Bureau at Department of Public Health and Human Services.
Thanks, Amy, and I hope everybody can hear me. Good afternoon. Hope your Monday is going well. It's great to be talking to all of you about probably a very, very important function that you have in the senior nutrition programs, and that is screening your seniors for their quality of nutrition and their health. Now, I think most of you are already familiar with the Determine form. It was recently redesigned, and I believe you all have that form. By the way, Jackie is also on this webinar, and we'll talk about a few things so we can both answer any questions. But thanks. So as I was saying, this is a very important tool by which you can help determine how well your seniors are eating. The form is simple, not technical, and you all already know your senior clients well. This helps to get you know how they're doing, not just at the site, but how they're eating at home. So I may be telling you things you already know, but how does the form work? Well, the form has to be filled, and for every yes answer, you will total the points. And by the way, you will, I think from what Amy said, you're already seeing the full form, but we will see the entire form just in a couple of minutes here. It's done with seniors at the senior meal site, or it is sent to seniors that are on the home delivered meals. Now, overall, by the way, this form is used all over the country by all states, and overall, most of the people that fill the form at your centers do quite well. But there are those that have a score of 7 or higher, which means they are at risk of malnutrition. And we'll talk about that in a minute. But when you see that the totals of the points add up to 7 or higher, then that gives you an opportunity to do what you can, and the way to do that is also provided in this form. That's because the point system is very simple. For those who have a higher score, you also have a sheet that will tell you how you can respond to them, and you can certainly add any other information that you feel would help the senior. For example, one question asks if they're drinking at least 3 servings of dairy a day. And why? Because you want to know if they're getting enough calcium. But if they're not, then the response to that will be also on the second sheet that that you have been provided. Same with if they don't have enough money to buy food, what can you do about it? So one thing I do want to mention, and that is that this screening, nutrition screening, which was developed by well-known organizations like the Academy of Family Physicians, the American Dietetic Association, and Council on Aging, is required. It has to be done at least once a year. And the Administration on Aging at the national level has said that this is a required tool that you should all be using in your sites, because you folks have the best access to seniors that you see, and you have the best ability, better than anyone else, to find out how your seniors are doing in terms of nutrition. If their nutrition is not where it should be, then their health will go down. So it's not only a simple form, but it creates awareness among the staff of your sites, and it's an education tool. You don't have to be a healthcare worker or a nutritionist to use this form. But what it helps you do is get an idea of how your person is doing, both in terms of food and their social needs, and find out how you can help them improve the quality of their lifestyle and their nutrition. So the annual screening is done, as I said, both at the congregate meal sites and the home delivered meals. The form is simple, and what you need to do varies just a little bit between the congregate meal programs and the home delivered meals. One thing you are asked is to have the seniors fill their names. Now, you may be wondering why this is not anonymous, but the purpose of the name is so you, as the folks running the senior nutrition program, can know when you see somebody with a risk level of 7 or higher that you need to work with this person. If, for example, you have a person by the name of Mary and you can see that she doesn't have enough money for food, she's missing meals, she may have dental problems, what can you do to help her, and not so much to solve her problems, but to direct her to the right resource so that she can find some relief for her problems. So you do need to know the name of the persons that are filling the form. You need to get their birth date because that's important for us to know, and also enter your meal site. That's partly because this information, not counting the names, will be going to the state at one time. You want to explain to the client that whichever questions have a yes answer, they should circle them, because those will be totaled, and that way you will decide which ones are at low risk, moderate risk, or high risk for malnutrition. So how does the form work? Earlier, I was talking about how you can get the form to work in your meal site, where your clients are right there. You have them there in your place, you pass out the form, request them to fill it, name, birth date, meal site, and the columns that say yes. Beyond that, they don't have to do anything. You collect the forms and total their numbers. Now, for the home delivered meals where you don't have the client with you, you need to have your driver or whoever is delivering the meals take them to their home. Now, the problem is if the person is not able to fill the form out on their own. In fact, I think it's very important that the driver explain what this form is about and that he or she would appreciate getting the information. But if the senior is unable to fill the form for whatever reason, then it would be very helpful if you could, if you know of a relative or a friend or a neighbor or a social worker who can help them fill out the form. As we talked about in the last webinar, the clients, the seniors on the home delivered meals are at highest risk for hunger and malnutrition. So it's even more important to get them to fill out the form and find out how they're doing. If by any chance your driver has time, it would be nice if the person would help the senior fill out the form themselves. So now, and I'm going to stop here, but here's a picture of the actual form, and side by side are the responses you can give that match each of the 12 questions. And I'll let Jackie talk about this a little bit.
Okay. Thank you, everybody that's attending. And Basically, as she said, that this is a sample form. This was updated in March of 2017. Now, if you've used the forms in the past, you'll realize that the rating on these forms are a little different. We had discovered that when we looked at the national form, that somehow a couple of questions got added in but didn't get scored correctly on the form that we had originally, and so we have compensated for that, and so point out that the risk factor is 7 or more instead of the past when it was 6 or more. So as you look at this form, it's pretty much the same format, and what else I put on there was a second page of the form that correlates with the numbers 1 through 12 about what some suggestions they may be in order to help rectify the risk that they are in. There are also, these forms are also on the link above, I believe, from what Amy had told you. If you click on, I think it's Aging Services on the top there, Amy, that it will show the form in full, in its full glory, I guess is the best way to put it. So,
yes, there are 2 Aging Services tab next to the Quick Start tabs. So.
Okay, so if you want to see them a little bit better, you can click into those and see how they correlate with that on the first and second page. Now, these forms are available in my office here at the State Aging Office, but they've also been made available to all the area agency offices and their nutrition programs. We also do placemats every year that has the same form on there, and it also is perforated because we understand that placemats do get dirty because we hope they use them, and they are the place for them to enter the same thing like their name and their birth date and meal site, and they can rip that off and turn that into the senior center person, whoever is collecting this information. So just let me know if you need more of these forms. But do look at the bottom. It says revised 317 so that you know you have the correct form. Once you compile this information, we do ask that you put this into mass. And Minkie, if you could advance to the next, thank you. And so this is a sample of a masked recording that you put in. You, of course, have their first and last name, and then the date that the information was taken. And client ID is usually associated with a person that you've put into masks. You'll see the scores are already put in. They're pre-filled. But you, as a person that is completing this particular masked screen, would check those areas that that person responded yes or circled, and that will automatically add your score. So you see this gal has a score of 11, which puts her at high risk. So of course at the top of that it says nutrition status, and so it does say high risk, and you can save this. There's twofold things here. You can look at the particular ones that seem to be marked yes, and you can figure out what some of the needs, etc. are. But also this information goes into our database, and we put this into our NAPIS report. It does give the feds demographics of the needs in the area. It does not focus on who the needs are. It just lets them know the demographics and what are some of the issues in regards to senior hunger in this program. And I think that's about all I have to say about this mass. I believe we can run off reports of this mass, and so we can submit reports to the area agencies so that they can continue to look at their particular statistics in their area for this program. Can you think of anything, Minkie, that I'm missing on this?
No, I don't think so.
And so the forms help you look at the particular or specific senior and to address those issues. And I think we can move on to the next.
Okay. Thank you, Jackie. Before moving on, I again put this screen on because I again want to emphasize that the purpose of this webinar was to share something that I'm sure all of you are already familiar with, and that is nutrition plays such an important role in the health of your senior clients. And this is such a simple tool to help you determine who is doing well in your senior meal sites and who is not, and to focus a little bit more on those seniors because, again, you all have the best relationships with them. We would really, really like to see more sites use these forums because I think we need to get the number of sites responding a lot higher than what they are right now. So I'm going to go through each question now, and with each one is the matching response that you saw on the other side of the screen. One is a question and one is a matching answer. So first one is, I or someone close to me has an illness which causes me to change the amount of food or the type of food that I eat. So your response would be to have them choose foods from all food groups as much as possible. And you all know what all the food groups are because you all have the basic meal plan that you use for your menu planning. And it is important that your seniors get all food groups at least once in a day, preferably twice or 3 times. They're only with you 1 time a day. For I eat less than 2 meals a day, there may be very many reasons why they're not eating more than 2 meals a day, but if there are seniors who just can't cook and are getting by with breakfast and lunch, you may want to check with that person and see if they want to purchase an extra meal to take home or meal or 2, more than 1 meal and freeze it to take home for a 3rd meal for the day.
If I could interject, Minkie, it also can give you an idea of whether or not they have access to programs like SNAP, or if they are taking advantage of the local food banks or commodity programs. They may not be familiar with those programs, and that would help supplement their meals. That
Right.
would just interject. Thank you.
Yeah, and we'll talk about that a little more for those who don't have enough money for food. Right now we're focusing more on nutrition. So seniors need, 3 servings of fruits and vegetables a day. And your response is to tell them to always have the 3, preferably 5 servings of fruits and vegetables. It can be canned, frozen, or fresh fruits and vegetables. But you want to encourage them to do that. Milk, and this is an example of why we want to know if they're getting enough dairy products. It doesn't have to be just fluid milk. And it could be used in multiple ways. So you might want to suggest to them that if you don't like drinking milk, use it in your cereals, soups, have hot drinks. But not only is it important to give them enough calcium in their bodies, but to help their heart function and their blood pressure. Question 5 asks if they have enough fluids in the day. They should be drinking at least 5 cups of fluid. Actually, it should be way more than that, not only for seniors, but for all of us. And so it would be good to suggest to them to get in the habit of keeping water nearby. I mean, none of us can drink a whole glass at a time, but if they've always got a water bottle next to them, they're more likely to drink it. And the dangers of dehydration among seniors is very, very serious. There are many times that seniors have ended up in the emergency room, and after doing all kinds of tests, they find out that the person was dehydrated and just not drinking enough water. It's also necessary for our circulation and good regularity of the bowels. Now, this is a concern that we need to look at if they're having 3 or more drinks every day. Actually, 3 is a lot, in my opinion. 2 or more would be plenty. It could be a number of reasons. They're lonely, and alcohol helps to kind of ease that pain. or they have, they have become in the habit of drinking too much alcohol. When that happens, when people drink too much alcohol, they are not going to eat enough food or food from all the food groups that we just talked about. So if that's the case, it would be good if you check with your area agency director or check with the state office for more information on how to help that senior, or if there's a local Alcoholics Anonymous group in your town, see if you can talk them into attending that, and let them know that the 3 or more drinks, as I said, it should be even less than that, is going to hurt their nutrition. And while it might feel good while they're drinking it, the result of poor nutrition will catch up with them. Question 7 talks about tooth and mouth problems. And I'm sure you all know seniors who, when you serve them their food, will say, well, I can just eat this, but I can't eat that because it's hard for me to chew. This is a fairly common problem, and it's possible that you might have to make some adjustments in your menu and give them food that's chopped or pureed, food with lots of moisture in it, or get them help to go to a dentist. There are so many examples of seniors whose dentures are not fitting well, and as a result they cut out the essential food groups and only eat certain things, which puts them at risk of malnutrition. So any dental problem should be taken very seriously. So now we're coming to the question that Jackie just mentioned, don't have enough money to buy food. And there are ways that, resources that they can use. SNAP, the food previously known as the food stamp program, is one of the best solutions to finding support for food. But in addition, there's the farmers markets, and there are local food banks in many of your areas. If none of that is available, check with your center director or public health department to see what's available in their community. And by the way, our last webinar later this year that we'll be doing is going to be on SNAP and how to get your seniors into SNAP. Now, almost all senior centers, as I understand it, have assistance technicians. So if you're not sure about how a person can get SNAP, and it is a little complicated, check with your senior center about the information and assistance person, because they will have information on how the seniors can access other resources for food that they don't have money to buy. This is another important question. As you know, the senior nutrition programs not only are required to meet the nutrition needs of seniors, but also their social needs. And drinking too much is sometimes the reason for over drinking. This is another one. I eat alone most of the time. And eating alone often does one of two things. Either the person eats too little or skips a meal, or they eat too much and gain excess weight. Either way, it's important that you help them connect to the senior center, find out what activities are going on in your community that seniors can join into so that they meet others, they make friends. Hopefully, if they are coming to the senior center, they're already meeting others who are there. As far as home-delivered meals clients, it is really a challenge unless there is somebody, a friend or a neighbor or a relative, who can visit them once in a while, especially at mealtime, because that is a risk factor. Medications. This is a very common problem with many seniors. Not only are they taking over-the-counter drugs, Aleve, aspirin, any number of things, but they have prescription medicines, which, by the way, also eats up a lot of their money. But this can have an effect on the appetite, especially for people dealing with cancer or some serious illness. It changes the taste in the mouth. Food does not taste good. And in that case, their pharmacist or doctor should know about this. The other thing to keep in mind is if, a lot of people think, well, my friend told me I should take this herb or this supplement and that'll really help me. But sometimes herbs don't mix with prescription medications and in fact have a serious reaction. So if you know that they are mixing multiple medications and they're not eating well, at the very least it would be nice if you could connect with, ask them who their pharmacist and connect with them or with their doctor, or if you have a social worker, to find out why this person is taking so many different items, not just those that are prescribed, and that might be creating a risk factor for them, not just for nutrition, but health in general. This is another very important question where without wanting to, the person has lost or gained 10 pounds in the last 6 months. This is pretty serious. If something like this is happening, something is going on that needs immediate attention. In fact, it could be, you don't even have to wait 6 months to find out. Even if you observe that in the last 3 months, one of your clients has suddenly lost weight or gained weight, you need to find out what's going on in their eating style and alert the doctor immediately. I think most of you do know, and I hope I'm not making assumptions here, who the doctors are, and if you don't, if you ask them, they'll probably tell you, because this is not something you can fix, and it's beyond you, but it is an indication there's something serious going on with their health, with their bodies, that needs attention, and there may very well be a way to find out the problem and resolve it, and so that their health doesn't get a whole lot worse. And finally, this is a question that I'm sure you're all familiar with, more so for the home-delivered clients. They're not able to shop by themselves or cook by themselves, or in some cases feed themselves. And that is a big problem, and again, I'm not saying you have to solve it unless you do know of some resources, but at the very least, talk to your boss, your program manager, your agency director, or call the state number and see what help can be given them, because if that's the reason they're not eating, with the proper resources, the problem can be solved and fixed. So those are the 12 questions. I know I've gone through them rather fast, but the responses that I have written here are all in that form that you have and that your centers should already have based on what Jackie has said. All right, so once the form is filled, what do you do? These are the 3 categories where you total up the number of yes answers. If the total score is 0 to 3, that's outstanding. That means they're doing very well. If the total score is 4 to 6, they are at some risk of complications from malnutrition, but it's not life-threatening. There are ways that if you can help them improve, or if you point out the responses of how to handle it, they can do it themselves. But if a senior has a total of 7 or more, then it is something to take up, to sit up and take notice of, because something is not working right there, and this person will certainly go down in their health. Again, I repeat, the quality of their nutrition impacts their entire health. So if you see a risk factor of 7 or more, I mean a total of 7 or more, something has got to be done there and is not right. So I'll stop here for a question. Okay, well, this last slide is what I would really like to spend some time on, and Jackie and I would like to hear from all of you. Why is this not happening? Why is this form not getting filled? There are a number of questions. Some of the reasons I've written are the ones that I have found out from talking to people on what the reasons are why these forms are not filled, even though they're so important. And since nobody responded to the poll, I'm assuming that it's not happening at your sites. But here are the reasons that I have heard from some folks at senior nutrition programs, that the staff don't have time to pass out the forms and collect them. As I said, this only happens one time a year. Or the seniors don't always want to fill out the forms. And that is certainly possible. They may think it's personal information and they don't want to share it. So that can happen. And the same with the next point, that they don't want to tell about their personal problems. It would be great if with those people you followed up one-on-one and said, I noticed that you didn't fill out your form. Is there something that we can just talk about so you don't have to fill the form? All I want to know is, are you getting good nutrition in your diet? Because they only eat at the most 5 meals a day at your site. What happens to breakfast and dinner? What happens to weekends? What happens to sites where you don't serve meals 5 days a week, and there are sites that don't? The other response we've had is it's difficult to get the forms sent out and filled by the home-delivered meal clients. Yes, I can see that that is certainly a problem. I think that a lot of information on your home-delivered clients you get when they first enter the program, when they first become a client. At that time, you do some intake information from them. That's the time to find out who their contacts are, the closest relative, friend, or neighbor, or somebody from your local health department who can go and check on them. Because even if they're able to, they may forget about it and the form just sits in their house for a long, long time, and then it doesn't get filled. And this is a population that we really need to know about and how they're doing. The other reason I've been given is, well, the driver is so busy delivering meals, he or she doesn't have time to help the seniors fill the form. Well, keep in mind, the form doesn't have to be filled the first day it's delivered, but if the driver person delivering could maybe help them, even 1 or 2 people on each of their, when they're driving to deliver food in time and in a few days or even weeks, they could get the form filled. So whatever you can do, and as I said, if you know of a friend or relative or neighbor who can help, that would be the greatest thing. And the other reason I got is not all seniors in the home-delivered meals have families. But that's the time all the more that you need to contact your local health department. There are places that have used very successful strategies. I don't know if any of those folks are on the call, but there are ways to maybe try and give incentives to seniors to fill out the form, which could be in many different ways: a treat, an extra treat in their food, a coupon for some store that they like to shop at, any number of different things that can be done so that you're getting them to fill out the form. Jackie, do you have anything more to add on this?
I don't. I know it concentrates a lot on home-delivered meals, but I know that sometimes we struggle getting them filled at the congregate meal. I do think the placemats have helped kind of alleviate that a little bit. We get back that they do like the placemats. and it's there in front of them all the time. So I just think I think you've covered it pretty well.
And we do have a question from Elizabeth Inman, and I'm going to go ahead and unmute her so she can ask the question. Okay, Elizabeth, you should be unmuted.
Okay, hi. Can you guys hear me?
Yes.
Yeah.
Yes.
Okay, perfect. So I am actually a dietitian at the hospital in our local community, and it's a smaller, more rural community. So I see a lot of patients that have just are at risk for malnutrition or have the definition of malnutrition. And I often just kind of do like an informal screening, I guess, for as far as if they have the knowledge about these programs and give them information on how to get in touch with our local program. Is there anything more as far as what I can do in my own setting to help the patients that I see, the people in our community, and just from your own perspective?
Elizabeth, I have just a clarification. Are you doing outpatient contact, or are they in the hospital at the time?
Most of the time that I see them and do this, they're in the hospital, but I also see the patients outpatient as well.
Okay.
It's a smaller hospital.
So, we in our office have a what they call long-term care booklet, but in that is a lot of the resources that these families and elderly may use that can help in things like SNAP and other programs that may assist them in reaching out to others. And it also includes how they can connect with their different local area agencies, so they can look in. If that will help, I'd be happy to send you one of those.
Yeah, that would be useful. I just, as far as what I know about the program, is all that I can offer, and a lot of them, at least the ones that I see in the hospital, aren't really too aware of the program, and so I just have to kind of explain some of the benefits of it to them. But yes, I can have some sort of, here's all the information you need to send it home with them, because sometimes they don't always, they have so much going on in the hospital. So
okay, so
that would be
if
useful.
you are able to email me directly, I can send you that information. I am not sure if my email was included. Amy, do you have a way of doing that after the PowerPoint stuff is over with, or can I just share my email? I'll just share my email.
I can write it down if you don't mind.
It's JSTOECKEL @mt.gov.
Okay, awesome.
And then
All right, I will just email you directly and ask you for that, remind you what it is.
Happy to send information to you.
Okay, perfect.
And Elizabeth, this is Minkie. Thank you so much for your input. It's wonderful to know that there's a dietitian that works with seniors. If you're at a hospital, I'm sure you work with seniors of all ages, clients of all ages. I wanted to ask the seniors that you have met and looked at for their risk factor, do you know if they're from the Congregate Meal Sites or from the Meals on Wheels program, or do you have both?
I have, as I've talked to people, I've heard that they do attend usually the Congregate Meal Site. But when I talk to them, I ask them, if a lot of them, it might benefit them to have the at-home meals delivered. And so I just kind of ask them if they are aware of it. A lot of them aren't even aware of it, so they're not part of either program. But so I just kind of do an informal. It's a pretty small hospital in a smaller community, so I just ask them if they're aware of the program, I guess, and kind of get, as far as what I have, the communication, the information for the person and the place in our community, so I can send them there. I don't usually communicate specifically straight with the senior center. I just tell the patient.
Right. But you have brought up an important point is we've been talking about seniors that are in the programs, but what
Right.
about the seniors that are not in the programs and
Right.
how to get to them, which would be ideal because we want to reach all seniors whether they're in the programs or not. But even to get this screening from those seniors that are there would be a huge benefit to give us a representation of how seniors are eating in the state. So thank you for doing that. Can I ask what town you're in?
Forsyth.
Okay, all right. That's great. And would you say that a lot of the patients there are seniors?
Most of the ones I see, yes. Yeah.
Oh, yeah. Well, that's pretty telling.
Yeah, it
Well,
is
thank
actually.
Is there anyone else on the webinar that can share why these don't get filled, or if you have used some successful strategies to get seniors to fill their forms?
So aside from that, so I wanted to ask you too, Minkie. So it sounds like the main way that people get these forms to fill out is that they're handed them at the congregate meals, or the bus drivers bring them with their Meals on Wheels.
Yeah, that's usually the way, unless there's some other way. I mean, by and large, to pass them out at the meal site in the congregate meals is not that complicated.
Yeah.
The question is to get seniors to fill the forms. They get distracted, they're visiting with each other, and even though it's only done once a year, and that's why I urge people listening to please tell the seniors, look, we only do this once a year. Could you please take a few minutes to fill it out? Now, home-delivered meals, that's why I said earlier, when a person enters the Meals on Wheels program, the senior center or the meal site does get some intake information about them, some personal history, contact information. So I would assume, or if not, that's the best time to find out who is your closest contact person. And if they don't have one, that's the time to see if you can get in touch with the local health office, unless you have somebody, if you're fortunate to have somebody like Elizabeth in your community, you could check with your local hospital and talk to the dietitian, ask to talk to the dietitian and ask her if she knows of seniors who are at high risk and are not eating very well. But somehow during that enrollment of the time when they get in the program, it's important to know how to reach the home delivered clients, because it's not just for this forum. I'm sure you have reasons to reach them for many other purposes, so you have to have a contact information.
I was wondering if it might be useful if when you, I'm sure you send out some kind of correspondence that these forms need to be filled out, if you included instructions on how they should ask, because I was thinking it might be if they handed this out to all the seniors and made them fill it out before they could eat, that all of them would fill it out.
Oh, I don't know that that would go over very well.
You don't think they could pass it out and say, hey guys, just take a couple minutes before we start the meal today, and it wouldn't go over well?
I mean, I don't disagree with you, but I would love to hear from the people that are on this webinar if you think that would work without getting people upset. Can anybody help by responding? Would that work if you ask them to fill out the form and then get their food?
Well, I can talk a little about it because I do focus groups at senior centers before their meals. And I often, many times before we've done it, we started the focus group before they've started eating, and they're fairly engaged. But I will say if I take longer than, 15 minutes to kind of get my message across, they start getting a little irritated. But I think it wouldn't be, just because I've gone and stood in front of a lot of senior centers and asked them to participate, maybe, I mean, technically it wasn't a written form, but it was more like a verbal survey. I haven't gotten a lot of negative response, and people seem pretty willing to do the survey as long as it's not interfering too much with their mealtime.
Oh, that sounds great, Amy. That really does sound great. Jackie, do you send any instructions when you send out the forms to the area agency directors on how to make these happen?
No, basically it is just sending out the placemat, which has the same verbiage on there because they have done these for so long that I think they all have their particular format or protocol of how they do that. I don't know what the stoppage point is, and because these do go to the area directors, how they pass that on to the senior centers, I do not know. I haven't heard any feedback in regards to how these are completed. I know with the placemats, they do get those completed. Whether or not they get them entered in, I think may be more of the difficulty than, because if we're going off the math, I think it's more of finding the staff to enter it into the math system. Does that make sense? I don't know if the issue is actually getting the form filled out.
Oh, that does make sense. I wonder too if, sorry, I'm getting my master's in public health, and we just talked about how to deal with this kind of issue similarly. And one of the things was having very clear expectations of what you expect. So I wonder if the sites know that, I mean, you know, you want an 80% return rate, or if there's a very, you know, strict deadline as far as you need to get these input by this date, or maybe not strict, but just kind of outlining what the expectations are very clearly.
And that's something I think I can talk with the area directors on as such. I know that they have, some are keeping tabs on who filled it out as far as the, they know by looking at their report of who's filled it out and who is due to fill it out. So I do think that each one handles it so differently. Their expectations to fill it out is they know it goes into the NAPLIS report and goes into the feds as far as the numbers, because they do get some credit and it's tied to funding. So I think that information is there, but that's something that I can research a little further.
Well, those are all very good ideas, and Amy, I appreciate you sharing what you have done with focus groups. If they were willing to talk to you for a few minutes before the meal started, I think there's very good possibility that they could fill out the form a few minutes before the meal started. Really, filling out the form would probably take at the most 5 minutes or maybe a little longer, but that's it. It doesn't take long. So I urge those who are working at the senior sites, the staff, to kind of, in a nice way, tell the seniors, this is very important, we need it. And actually, if there is a goal to be reached, that might create more of an incentive to get it filled. Now, one person I talked to who has had success with this, and I don't know if that person is on the call, actually went to a local store and got some small $2 vouchers so that they can go and redeem those and then pass them out to those who fill the form. You know, whatever it takes, you all have a very creative ideas. I work with the Montana Food Bank Network. If it were possible to give food incentives, I can speak to them about sending some treats for those who fill out the form. I don't know how well it would go over, but with seniors, as with people of all ages, incentives work very, very well. So there are a number of ways, but first it needs the dedication of the staff at each site to try and get as many filled as possible. This is such a critical forum that I hope you can come up with some creative ideas. And Amy, if there are no other comments, I guess we'll end this. But could you please put Jackie's and my email in case anybody wants to contact us after the webinar is over with specific questions or comments, because we really need feedback on this topic.
Yes, I can send out a post-webinar email with the links and your emails as well. So I'll CC you in those so you can see who I'm sending it to.
That'd be great. Thank you.
Okay. If there are no other questions, we'll go ahead and wrap up. All right. Thank you so much for joining, and thank you for your time, Minkie and Jackie. It was very informative.
Thank you for your help.